Medical tourism could be one of the biggest potency in terms of tourism sector. France report linker even predicted that Indonesia's medical tourism could be reached the value of 143 billion US dollar in 2025. Indonesia can cater its domestic and foreign tourists in the medical tourism sector, and that will happen if Indonesia improving the quality of its healthcare facilities, medical experts quality, and etc. Unideal healthcare facilities making Indonesians going abroad to have a better medical treatment. So how many Indonesians doing travel abroad to do medical tourism? Let's see the data. This one is taken from the 2006 and 2015. And in 2016, actually, it's not 2016, but 2006, the number of people that conducted or doing a going abroad for medical purposes, reaching 350,000 of people. But in 2015, the number is increased significantly to 600 or 600,000 of people. And from the research of International Medical Travel Journal, when asked why Indonesians seek medical treatment abroad, many Indonesians say the healthcare sector in Indonesia is poor and the price of medical help abroad is acceptable considering its quality. Neighboring countries such as Singapore and Malaysia are now aggressively promoting their healthcare services in Indonesia, as can be seen in advertisements with attractive slogans such as affordable health checkups or health tourism. And how big is the value of money spent by Indonesians when they're doing medical tourism? Let's check the data. Okay, in 2006, actually, the amount of money spent by Indonesians reaching 0.5 billion US dollar. In 2015, reaching 1.4 billion US dollar. And still from the research of International Medical Travel Journal, the skills and attitudes of healthcare professionals working in Indonesia is not poor, but the system adds to the dilemma. As patients tend to go directly to specialists, the treatment they receive is often not holistic. Patients also often question the necessity of expensive examinations carried out by Indonesian doctors, who often fail to be communicative enough. When patients seek a second opinion abroad, more often than not, the same examinations and tests will be carried out, but will be explained to them properly and in terms they understand, enabling providers to justify the expense. So what are Indonesians' reasons of doing medical tourism in either or to another countries? Let's see the data. 42% of the people that had been surveyed by McKinsey answered because health facility or medical facility in other countries except Indonesia, they have modern technology, 33% better treatment, 16% better medical services, and 9% cheaper health care fee. And Indonesian hospitals and pharmacies have no concept of customer service. Patients are often forced to wait a long time to see the doctor. Consultations also often seem hurried due to the limited time doctors have. Nurses seem just as busy or unwilling to help as doctors. In public hospitals, patients have to buy their own medicines or they will receive nothing. In Singapore, patients have scheduled appointments, so they do not have to queue. In Singapore and Malaysia, Indonesian patients are happy to pay for expensive examination as their conditions are explained thoroughly and doctors rarely keep them waiting. So which countries had been considered as medical tourism destination by Indonesians? Let's see the data. This is the list of countries that had been considered as the traveling or medical traveling destination. The first one is Malaysia, second one is Singapore, and the third one is Thailand. This one is taken from Indonesia Services Dialogue. And Indonesia has set itself an ambitious goal of establishing universal health care by 2019, which is this year, a move commended by the United Nations as part of the 2030 Sustainable Development Goals. Technological innovations from private companies provide crucial contributions to the efforts of healthcare providers and local and national governments in providing appropriate healthcare, facing some challenges in improving medical facility in medical tourism in Indonesia. Indonesia is actually have a huge potency in terms of traditional medical tourism, but the potency haven't been maximized yet. But the condition is not only happen in Indonesia. Many countries also find it hard to maximize the growth of traditional and complementary medicine. To have a clearer view on this, let's check the next data. As much as 69 countries having lack of regulation when it comes to slow growth of traditional and complementary medicine, and 70 countries having a problem with, lack of trainers, lack of supervisory mechanism, as much as 75 countries experiencing the same thing, and then lack of research and development budget, 86 countries, and lack of research data, as much as 99 countries experiencing the, some obstacles when it comes to the growth of traditional and complementary medicine in the world. And while the quality of modern medicine in Indonesia has improved over the years, a majority of locals are still heavily dependent and keen on using traditional or unconventional healing methods in conjunction to Western medicine and to recover from illnesses. The huge potency of traditional and complementary medicine in the world had not been maximized yet, even though it could be considered as optional method to improve people's health. Abundant source of herbs in Indonesia should be utilized so it can be seen as potential traditional medicine tourism for the country. And I'm humbly wishing Indonesia best of luck in improving its medical tourism sector. Stay tuned on Market Headlines because we will be right back after the break.